Hello, everyone, and welcome to the Toronto General and Western Hospital Foundation virtual Q&A. I'm Christian Cote, host of the UHN podcast, Behind the Breakthrough. We're glad you could join us and are grateful to you, our family of supporters, who've been so generous throughout the COVID-19 pandemic. So a big thank you on behalf of the foundation and all of UHN. Today, we're discussing the latest on the virus and how to maintain mental health. Joining us are Dr. Alon Vaisman, a UHN infection prevention and control physician. Welcome, Dr. Vaisman.
Thank you for having me.
And Dr. Susan Abbey, UHN Psychiatrist-in-Chief. Welcome, Dr. Abbey.
Thank you, Christian.
As always, my guests and I are practicing physical distancing, so we're in different locations. Let's start with the latest on the virus in the news this week, Dr. Vaisman. And Toronto and Ontario continue to lead the country with daily infections. What, to your mind, explains the persistence of the infection rate here compared to, say, a Vancouver and BC?
It's a good question. The answer to that isn't quite clear yet. I think there's some theories about why that might be happening in Ontario, including the contact tracing. I think there's some concerns that the contact tracing here in Ontario have had some delays. I think they've been quite overwhelmed, the different municipal governments across Ontario, including Toronto, to be able to identify cases and contact trace them properly, which means finding out who else an individual who has COVID has come in contact with recently. And some other issues have been in terms of getting access to tests. That was a concern earlier in April and in May. And recently the testing has been expanded to include more people who want to be tested. And about 2 weeks ago, virtually anyone who even symptoms or non-symptomatic can get tested. So I think those are the elements which might explain why things haven't come down. I should say the number of cases hasn't come down as well here as it has in other parts of Canada.
And I'm curious, do we in Ontario, do we have a good handle on how the virus is being transmitted?
I think initially during the outbreak in March and April, there was a big emphasis on long-term care facilities. We were seeing that a significant number of patients there were being affected and a significant number of people dying from the virus occurred there. But as the control in long-term care facilities has improved over the course of April and May, now we're seeing that perhaps the reservoir of the virus might be more and more in young people. And the public health messaging has been now reoriented to try to have more and more people tested, especially those who are very mildly symptomatic and especially those who are younger and healthier, who think that they may not have the virus because they may otherwise be okay. So I think that has targeted that kind of targeted messaging has improved our ability to track the virus and find out what's going on.
I want to bring Dr. Abbey in because with all this uncertainty still out there, for some of us, Dr. Abbey, it creates this feeling that we've lost control or a semblance of control in our lives. How do you counsel people in this situation?
Well, we have all lost control, so that it's not just a semblance.
Okay, it's not just me then.
It's not just you, it's all of us. And I think so that the benefit of this is I think it's a really stark reminder for us of how illusory our control over life really is, and hopefully some good things come out of that insight. It's going to be a defining moment for many people's lives. The majority of us, listening to the broadcast today, talking to you, have been very blessed to live in a time of peace and comfort and have a lot of control over our lives. I always think about, in January I could go to Starbucks and get the exact temperature to the centigrade and the exact number of pumps and shots and how much froth I wanted, and this feeling that we have control over everything, but we don't have control over the virus. And there are many things that we don't have control over. We don't have control over how quickly our infectious disease colleagues are going to get us a vaccine. We don't have control over, how our public health colleagues are going to manage things. And so in some ways, I suggest to people to try not to spend a lot of time thinking about those things that we don't have control over. And it may sound a little too Susie Sunshine, but I think we need to really keep in mind that we do have things that we have control over, that we have control over how we're going to behave. We have control over how we're going to be able to look back on this time in our lives. We have the ability to choose kindness. People are really struggling now, and we can choose kindness and compassion. We can choose optimism. We can choose how to live our best lives within the kind of constraints around us. We can choose to control things that don't serve us well. So I really counsel people to be very careful around social media, around the news, what types of news, what formats we're engaging with. And I think that we can control the things that can help us feel better within the constraints imposed by the virus. So taking good care of our physical bodies, sleeping well, eating well, calming our bodies and minds. We can consciously seek out small forms of pleasure in daily life. We can perform acts of altruism. We can help other people. And we can really commit to controlling what's important to us in terms of living a life that we value, that's meaningful to us, and that's helpful for us. And hopefully, when I said about maybe the silver lining to this cloud is that we might also develop a greater sense of understanding and empathy for what it's like to not have our lives in control, because there's so many people on the planet right now that don't, and that might then spur us to take some greater action to help those who are really dealing with major medical illness, major physical illnesses, poverty, racism, living in war-torn areas, all of those social issues that potentially we could be helpful with.
I'm curious about parents specifically, Dr. Abbey, because my senses are multitasking more than ever, taking care of the kids at home while working often from home, or having to find childcare in these very difficult times because they have to go to work. There's, cleaning, cooking, standing in line for groceries. It can be pretty overwhelming. And I'm wondering if you have any specific suggestions for parents during this time.
Well, I think the first thing we have to do is that we really have to take care of ourselves. So, and we have to try to figure out, this is a very strange time. It was interesting in some of the questions that came in from the audience. I saw, some things about like, how do I get my kids to do this or do that? And I thought almost with some of them, I think you just have to really go back to these sort of fundamental principles of like, what's really important for our family? What do we value most within our family? And then let some of the other stuff go, because the kids are really stressed out too. And at the end of the day, if some of them are staying up later, or they're eating a little too much junk, or they're not working as hard on their schoolwork, 5 years from now, that's all going to be okay. What they're going to remember is like, did we love them? Did we try to respond to their emotions? Did we give them a sense of safety and comfort, if that makes sense?
Sure. So basically stick to the knitting as a parent.
Yeah, and it's really, in some ways, that takes a whole lot of pressure off of us. I see so many. I'm very lucky because I'm the mother of teenagers. So I'm not lucky in some ways, but but like I have a lot of colleagues who have little children, and I'm just like, they've got all these kids. They're going to have long lives. They're going to have back to normal education eventually. There's going to be a lot of time to make up some of this stuff. Doesn't all have to be done now. And if we're trying to manage, jobs, shopping, caring for elderly parents in the midst of all of the constraints of COVID, something's got to, you got to let something go. And I think the thing you can't let go is loving the kids and helping them to feel as safe as they can within all of the sort of craziness in the world today.
That's terrific. Dr. Vaisman, look, restrictions continue to ease, which is great. People, though, are still concerned about how to protect themselves and their loved ones when they go out. So I'm wondering, for example, when we have to leave the house to go on the bus or subway, or we do have to return to the workplace, or pretty soon places such as hair salons and daycares will be opening. What's your guidance in this regard?
That's a great question. I think the first thing to do is to follow the guidance of the provincial government when they release different recommendations around what to do in certain settings. It's important to keep a close eye on those things and follow them closely. Also, the federal government also releases guidelines about this regularly. The second thing is to continue to try to do what we should really be doing anyway during most flu seasons, which makes a lot of sense and are really things that are not that hard to do, like washing your hands, not bringing your hands to your face, trying to keep distance. Sometimes it's easy to fall back into certain habits, but I think more and more people are getting used to these ideas because we've been doing them for several months now. So as things open up, it's important not to fall back, not to slip, and to continue Unfortunately, the way that COVID is going, this isn't going away anytime soon. So these kinds of habits, these good habits that we need to form, unfortunately, we're going to have to do them for a very long time. And the more we're able to do it, the better we're going to do a better job for everyone in our society. So every individual can do their part to try to prevent transmission of the virus.
So in terms of good habits, would you also include in that category wearing a mask when you're out?
Yeah, that's a great question. I would say that the highest value of wearing a mask is certainly in the indoors. There's less value doing it in the outdoors. When you are wearing it indoors, I think it does provide a benefit in reducing the likelihood that you're going to transmit the virus to other people if you have the infection, and it reduces the likelihood that you may acquire the infection from somebody else who has it. This is something that we're just also going to have to get used to as long as the pandemic is ongoing. It may be that at some point the disease is very low and the prevalence is very low in the community. We can pull back from this. But at this time, I think we should follow the guidance of the federal government, the Chief Medical Officer of Health, who has recommended using at least non-medical masks in public settings.
Right. Okay, and I understand you've actually brought some masks with you to show us the proper way to use them, because I know some people were a little confused on it. Do you mind demonstrating for us then? And first of all, maybe tell us, what have you brought?
Sure. So you may see that in healthcare settings, people are using this sort of mask, which is a surgical mask. The surgical mask or procedure mask is used in a healthcare setting to protect healthcare workers from the virus, and also incidentally, if they have any kind of respiratory infection, it protects patients as well. The other kinds of masks you might see people using in the public might be a cloth mask like this. So a cloth mask is similar in shape. It also has the ear loops here. It has a bridge. You can put in a bridge, or you can purchase one that has a nasal bridge along the top here that you can mold. And also, some of them may contain filters or just be made out of cloth. Another version, which I haven't brought today, is you can even make a mask out of a routine cloth material, even out of T-shirts if you had to. There's websites where you can Google, like the CDC actually, where they show you a demonstration on how to do that. But if you go back to the surgical mask, we see how I'll explain how you can actually put it on properly. The first principle I would say is that anytime you put your hands next to your face, you should be washing your hands. So I've sanitized my hands. It's important to do that before you bring your hands here, just in case they're dirty. But an important principle of touching the mask is to avoid touching the front part here. So this area here, it's important not to touch it, because that leads to you contaminating your own face. So when you take the mask, pull it by the ears, bring it over your nose and over your chin, just like this. Bring the ear loops back over your ears. And then without touching the front part, just try to touch the nasal bridge, and then mold it over your nose, just like that, over the top of the arch to make sure that it's tight. And then down here, make sure that you're holding the back so you can actually make sure that your nose and mouth are covered. So once the mask is on your face, you wash your hands after that, because you've touched your head and neck. You do whatever you need to do. You go out shopping. You don't touch your head and neck as much as possible, because now you're touching surfaces. You're bringing it up here. You're contaminating yourself. When you're done, whatever activity you're doing, let's say you've gone shopping and you're going back into your car, or you're going back into your home, you wash your hands again using alcohol rub. And again, you remove the mask by touching only the ear loops and taking it down and away from your face. And then if you're using a disposable mask, you would dispose the mask. And if you're using a non-disposable, you would try to clean the mask. So it would be advisable to wash your non-disposable or your cloth mask like this one, probably once a day if you've used it several times in that day.
And that surgical mask, sorry, just to go back for a second, what's your sense of how many times you could reuse it?
That's a great question. Generally speaking, the surgical masks, their intention is not to reuse them. And so we don't have good evidence to know about how long it's safe to do so. My general recommendation is that you can continue wearing the mask as long as it's not become significantly contaminated, as long as it's not very moist, as long as you can breathe through it, and as long as it's not been damaged anyway, like the loops have been torn, or the bridge is no longer working, or there's a hole in the mask. If any of those criteria are met, you should discard the mask and get a new one. Otherwise, you can continue using it. I would say don't use it more than one day at all.
Okay. And in terms of the cleaning of the cloth mask, just a regular detergent that you might have at home?
Yeah, although COVID-19 is actually very easy to transmit, it's actually also very easy to kill. So just the routine cleaning detergents you would use at home is sufficient. Just keep in mind that if you're tossing the cloth mask at home into your laundry, just put it straight into the laundry or in a basket. The reason is that if somebody else in your home comes by and touches it and the mask is contaminated, now their hands are contaminated, they may not be aware. So it'd be good to just put it away in the laundry as soon as you can, so that people are aware that they're not touching contaminated material.
And would you be concerned at all putting the surgical mask into the washing machine with other clothing?
So the surgical or procedure mask, you wouldn't wash, you would just discard it when indicated.
Sorry, I meant the cloth mask. You're right.
You're right. Yeah, totally fine if you include it with other things. As I mentioned, it's not hard. It's relatively easy to kill the virus in these kinds of environments. So you can turn up the heat in the washer, it should be fine, and you'll kill the virus. It's also unlikely that the mask is heavily contaminated with the virus unless you yourself are infected, in which case you should take extra precaution. But if you're just using the mask for routine reasons and you yourself don't have the virus, it should be safe to just clean it with the rest of your items.
Terrific. Okay, let's bring Dr. Abbey back in, because we're coming to understand that we're not likely to return to normal, or be 100% safe until there's a vaccine. So, this could take months, I hear. It could take years. How do you suggest parents talk to their children about this kind of lengthy, uncertain future?
Well, I think that's really a big question for parents and for grandparents. One of the things that I think is really important is that we have to be very sort of cognizant of the sort of developmental stage of the child, and really that for the little ones, that really just the message is that we're doing kind of strange things, but we're doing them because it keeps everybody safe and we love them and we're going to take care of them and things are going to be okay. I think if we start to get into discussions of how long it's going to be till school reopens, it gets really overwhelming, and you just have to think back to the last, whether it was a family celebration or a holiday or something, and talking about the number of sleeps. If you start into, it'll be 480 sleeps before we can stop this. It's too much for the kids, the little ones. I think for the school age kids, often artwork can be quite helpful. Seeing what they're drawing, ask them to draw a picture of COVID, or ask them to draw a picture of what things are like for them now. Ask them how they're doing, ask them what they're hearing from other people, because they may be getting misinformation. Letting them do things that are often simple pleasures around the house that we might not do as much as we'd like to with them, like things like, baking and helping and crafts and things. For the teenagers, I think it's really important to remind them of why the restrictions are in place, and that this isn't just something kind of stupid that public health has made up, but really by following the recommendations of public health and by doing our physical distancing and keeping not going out in large sort of marauding hordes, that they are actively doing something that is protecting the lives of people that's important to them. So whether that's their parents, whether it's their grandparents, whether it's other loved ones in the family who have medical vulnerabilities, so that they really are lifesavers by doing this. I think we also have to empathize with their losses, with the things that they should normally be able to do and that they can't. But all the while, try and just subtly, I try to add in some perspective. So, one of my daughters, it's grade 12, so she's missing prom and graduation and all of those things. And I've said to her in one way, yeah, we talk about how sad it is, but in this other way, I've said to her, really, she's going to have a very long life. And if her grade 12 prom is the highlight of her life, then I haven't done a very good job as a mother, raising her, and she's not going to have a very good life. So that really this is a kind of small chapter over a whole long life, but that we really have to abide by the restrictions. I guess the other thing that I'd recommend for parents of any age kid is to be really cognizant of kind of what's playing on our computers, on our TVs, what kind of news people are hearing, and then how that could, I think it's very easily misinterpreted by little ones and school age kids, but it may also be quite misinterpreted by teenagers. So we've had some discussions of trying to put the risks in perspective. It's not like, every other person in the street is dying, but it's also a serious illness, and we have to live our lives with restrictions to keep people that we love safe.
Speaking of that sort of relentless daily treadmill of news about the pandemic, my sense is it can create a sense of hopelessness. Like it's a feeling almost of like, why bother? Why make all this effort to stay home when we can't go back to our normal lives? So how do you counsel people on this score?
Well, I think that's a really hard one, because I think it does feel like it feels hopeless and helpless, and all of the pleasures that we normally recharge ourselves with aren't available. I think two things that I really encourage people to think about is, if that's a feeling that is transient, or if it's really pervasive. And if it's really pervasive, then I think we have to be concerned about whether people may be developing a major depressive disorder or an anxiety disorder in the context of COVID. So there's a long scientific literature that shows how we're vulnerable to developing these very human problems of depression and anxiety with high levels of stress. So if it's really pervasive, persistently hopeless, low mood, or high anxiety, nothing lifts it, can't laugh, can't concentrate, can't focus the mind, either sleeping or eating too much or too little, then I think it's really important to reach out to the family doctor to sort of get some advice and get a little bit more thorough look at things. If that's not the case, and it's a kind of transient hopelessness that comes and goes, then I really encourage people to kind of come back to this question of, what's important to me in my life, and then how can I enact that, or how can I achieve some of those goals within the constraints of COVID? So maybe we need to get a stat consult from a philosopher on that one. But what is meaningful to me? What matters? What do I value? One of my favorite psychiatric colleagues says in tough times to try to sort of set yourself up by saying, what do I want to be able to say 10 years from now or 5 years from now about how I got through this period of time? Are there actions? Are there things that I can do or take that will help move me towards those goals? And then I think the other thing, just fundamentally, I think that, the things that really matter to people are kind of living well and loving well. And we can do both of those things in the face of COVID in a constrained way. We don't have the kind of expansive choices, but we can choose to be good to people and to try to move the world forward, and to reach out and to be kind and to do those sorts of things. But it's hard.
That's terrific. Yeah. And I don't know if this is a measure of hope, but Dr. Vaisman, I read a lot now that a measure of how we're doing against the pandemic is to look at the percentage of positive cases in the province versus total tests. That can apparently tell us how we're doing. I wonder if you could explain this measure, of how we're trending in Ontario at the moment with positive cases, total cases, and where we hope to be.
Yeah, it's an interesting number to look at, because the interpretation of the percentage positivity can have several meanings. So there's two components: the number of tests that are positive and the number of tests you're doing in total. So the positive ones divide by the total. The total depends on your testing criteria. So a few weeks ago, we expanded our testing criteria. So now we're doing a lot more tests. So the percentage of positivity should go down, and also the access for people to get tests. So again, the more people have access to it, that percentage positivity goes down. Then there's the other side of it, which is the number of people who are swab positive. And this depends on the pandemic, on how many people have the disease. So your proportion of positivity can go down because there's just fewer people getting the disease, or it can go down because you're testing a lot more. And then on the flip side, it can go up because a lot more people have the disease, or because you're testing fewer people. The thing is that the number just has to be interpreted in the context. I think in general, you don't want that number to be very high, that percentage, because that means you're probably missing a lot of people. And you don't want that number to be very low, because it means you're probably not testing the right people. So if you interpret in the context in Ontario, having that number drop in general is a good thing. You just also have to realize that it's also because we've expanded the testing a lot recently. So it may not tell the whole story, but it tells part of the story, and it is assuring that it does come down.
And can you give us a sense of that percentage ratio? I mean, because we can do that. I did it the other day. You can actually do it yourself at home.
Yeah.
Where is that optimum ratio or range? And, which way do we want to be trending, or how do we want to be trending?
Yeah. So generally we do, of course, want to be trending down. most people would say that if your percentage of positivity is somewhere between 10 and 50%, that's very high. And it either means you're not testing enough people or that the disease is a little bit uncontrolled in your setting. Below 10%, around 5% or less, is generally considered that you're doing a good job and the pandemic is getting better. There's other measures that you would look at as well, along with the proportion of people who test positive, including the total number of tests you're doing, and also how many people are admitted to hospital or how many people are in the ICU, how many people have died. The fact that we haven't seen a bump or rise in the number of people getting admitted to hospital or the ICU, even though the number of cases continues to be stable, is a very good sign. It means that probably there's a lot more cases being detected in the community that are pretty well. They're well enough not to have to come to hospitals. So that is a good thing.
Yeah. Dr. Abbey, for 3 months now, Ontarians have been doing their part, staying home, but it does get to be a grind, as we all know, and it can take its toll. Is there a mental exhaustion that you sense out there that people are coming to you for?
Well, so my big secret, I feel that way. I bet you feel that way, right? I think we all.
I fully admit it. Absolutely.
Yeah, I think it's really hard, and I think part of it is that there is a genuine exhaustion from kind of living in this sort of sea of anxiety. So I think it's really important to take care of ourselves, are physically well. I know I'm going to bed earlier at night and tuning up my sleep, and I think a lot of people that I know are doing that, and that's really important. I think I think physical exercise is really important. That's easier for some people who are listening than for others, depending upon, what you can do and what your space allows. But even sort of making sure if you're working at home that you're getting up, from your desk or from the ironing table you're using every hour is helpful. I have probably one of the world's biggest collections of COVID humor memes, because humor is something that re-energizes me. I think nature is really helpful for people, and so that may be, if they're lucky, they can go off to a country property, or they can go off on a trail or hiking or doing things like that. It may be walking in a trail in the city. It may be just like, starting to grow herbs inside your kitchen and watching them grow and having something green. I think we can think about how do we find pleasure, because I think a couple of weekends ago, my admin assistant said to me, like, you need to take the weekend off and recharge. And I thought, well, man, everything that I would make on my list, if I counted out what kind of things recharge me, like, they're all closed. So, or I can't do them because of COVID restrictions. But starting to think about, well, and this is something that I often do with patients with major medical illness. Like, well, so, okay, if you can't do that, like, what would be a substitute for it? And trying to think about that. Trying to find pleasure, some pleasure, even if it's small pleasures in daily life. There's a practice, it's called a gratitude practice, where at the end of the day or in the middle of the day, sometime in the day, you just write out 3 things that were good about today. And I think that can be helpful. Using technology, so trying to replicate some of the things that we like to do. Now, you can do virtual. We had for our mental health physician group, we had a virtual cocktail party last night, and people had a really nice time talking and catching up with each other, or dinner parties, or dance parties, or watching a movie together, or playing trivia or something. Then you can do that across the net. And then I think the last thing is just really, at times when it feels like just too much of a grind, really, again, coming back to reminding ourselves, why am I doing this? And we're doing this because we are saving lives. We're saving the lives of people that we love. We're saving the lives of other people in our community. And that's really important. Very early on in the COVID epidemic, I saw something on the internet that said, remember, for your grandfather to save lives, he had to go to war. You need to sit on your couch. And so I always think about that in some ways, that when things just get too much of a grind, like, I'm saving life by staying home this Saturday afternoon.
Sure,
And
puts it in perspective, yeah.
yeah.
Okay, Dr. Vaisman, I'm going to put you on the spot. After 3 months of emergency order, staying at home, people are asking, how does all this effort get us to 0 cases?
Yeah, it's a good question. I think there's two purposes for the lockdown. One is to immediately prevent there to be a surge in cases of patients who need to be admitted to the hospitals and not to overwhelm the acute care sites, which succeeded in Ontario. The second is to buy us time for a long-term plan on how to manage the pandemic. So now that we're 4 months out now, we would hope that governments in Ontario, Canada, across the world have come up with a plan on how to manage the pandemic in the long term. Because as you've said several times, it really only boils down to a vaccine. It's going to be very hard to bring us down to 0 without a vaccine. That's not to say that all the efforts of the last few months haven't been pointless. Of course, they've had a huge success in being able to not only prevent many cases and prevent deaths, but also instilling in everyone the importance of these measures that are going to be with us for the long term. So because our behaviors have been changed, that helps us eventually decrease the numbers significantly. And also it gives us the time to plan and to make things safe in the long term for various schools, workplaces, hospitals on how to manage the pandemic in the future. But getting down to 0, I think we just have to be realistic that it's going to be very hard to get to that. In human history, there's almost no infectious diseases that we've been able to eliminate. There are examples in the world like New Zealand where there have been 0 cases as of a few weeks ago. And that's great and that's reassuring. I just think that'll be a lot more challenging to accomplish in Canada, given our connectivity with the US and also with other countries for business and industry, tourism, all sorts of things.
I want to get to our questions on slide. Last question to you, Dr. Abbey, because I'm just wondering if there are any, general tips or resources that you like to cite in terms of managing mental health and strain of the pandemic to help us maintain resilience.
I think that there are a ton of them out there, and I really encourage people. It's like going to shop for some new piece of clothing, picking out one that fits you and that kind of works with the way your brain's organized. You just put in COVID resilience or COVID coping tips, you'll get a ton of them, and then you can start to see what's helpful for you in terms of, do you like things better written or watching videos, or sort of what works best in that way. The 211 number in most communities has resources. The Kids Helpline is now taking calls from adults around COVID, so that's very helpful. I think at the start of the epidemic, a lot of the family physicians' offices were closed, but almost everybody has transitioned now to virtual care. So I think reaching out and having a telephone conversation or having a computer conversation with family doctor or with local mental health resources can be helpful. I think we're really trying to sort of build resilience, find things that are physically relaxing for us. So, Google relaxation exercises or potentially the large online meditation companies like Calm and Headspace. There's one called 10% Happier. All of those have free COVID accessible resources. I think that there's a lot to do, but sometimes it's just kind of wenching ourselves up from our hopeless, helpless stance to get looking.
Great. All right, I think it's time we should move into your questions out there. Let's bring up the Slido slide to get a sense of what people are talking about out there. First one, is there a special routine to enable me to hold my 2-month granddaughter, perhaps with a gown, mask, and gloves, and for a short time? Dr. Vaisman, I'm pretty sure that should probably go to you.
I suppose it depends on the situation. If your grandparents are living with you and they have common contact with you and your family and your grandkids, then there really isn't anything specific you need to do because they're in your bubble, so to speak. And that's already part of your contact. So you're not putting them at increased risk by simply holding them. But if your grandparents are outside of that cluster, your little bubble, then you could try to take additional precautions to try to protect yourself as the grandparent. I'd be more concerned about the health of the grandparent than the child in this case, because they're more vulnerable to having serious outcomes. If it's really push comes to shove and people do want to have contact outside of their bubble, then certainly taking precautions makes sense. just that wearing a gown is not something that people commonly have access to or know how to properly put on and take off. Washing hands and wearing a mask, I think, makes sense for the adult, and just trying to minimize the contact as much as possible.
Thank you. I think staying with you, Dr. Vaisman, for this one too. When my workplace opens, I'll be working with children. What should schools and daycares do to keep staff and kids safe? What precautions should childcare education workers take? And will it be safe for me to see my elderly parents while I am working? So it's sort of a two-pronged question there for you.
It's a really big question that's going to face us very soon, is about how to manage schools. If we look at examples in other parts of the world, they have taken extra measures to protect children, but the nature of the problem is very challenging, because what we do as adults can't be reliably done in children, such as keeping distance, washing hands, not touching things, not putting your hands in your mouth. So all those things, I think schools in Ontario will do their best to try to enforce. The washing of hands, keeping the distance, not coming to school if you're sick, not putting your hands in your mouth, all those things. But I just don't know how well they'll be able to be done in certain populations, especially younger kids. But those are the things that will be done, that will be encouraged in the children. As for the elderly parents, I think the answer to that question will be dependent on where we are in the phase of the pandemic. If the prevalence of disease has fallen a lot, if we're not seeing very many COVID cases, it may very well be safe to start interacting with your parents. It just all depends on where we are. If there's a wave of cases that increases, then that it won't be safe, because the risk will go back to where it was back in April.
A bit of a similar question has just popped up. Even though things are opening up and now groups of 10 people can congregate, should seniors over 70 return to work, if still working, remain isolated from children and grandchildren? And for how long do you think seniors will be at higher risk? I don't imagine that's going to change much, is it?
That's right. It all depends, again, on what the situation is in Ontario, or more specifically in your region. If the number of cases remains very high, then the risk of an elderly person older than 70 attending work it will still be there. And I think they have to, if it's an essential service that they're providing, or a frontline healthcare worker, for example, then there are, of course, measures that we take in those circumstances. And similar to what I was speaking to earlier, would be the same measures you would take regardless of where you're working, to try to prevent transmission. But I think the going back to work, if you're not currently there and you're going back, I think that decision will be guided by the province, and will also be guided based on your local prevalence in your community.
And I imagine your workplace as well.
Exactly, yes.
Yeah. From Rob, how much does one have to worry about COVID-19 on takeout food from restaurants?
It's a good question. I think overall, it's not a very high risk. As long as restaurants are adhering to the practices that they should be doing even prior to COVID, about washing hands and maintaining sterility, or maintaining cleanliness when they're preparing food, it's not a very high risk. We haven't seen examples of that in Ontario or in America, where people have acquired the virus due to takeout food. I think still the common sense principles apply. If it's something that is meant to be heated, you heat it up. You don't eat it cold. If it's sitting in a box, you take it out of the box, put it in your own utensils, and try to minimize the contact you have with the outside utensils that they're providing you. Try to wash your hands before and after you eat. I think all those kind of common sense things make sense, and I think the overall likelihood of you picking it up from takeout is low.
From Claire, for you, Dr. Vaisman, is there any way of avoiding the misting up of glasses while wearing a mask? It can become a real problem, and that's for sure.
Yeah, generally that happens because the seal, as I was indicating earlier on the mask, the seal around the nose isn't tight. So some masks are not very well built, and they don't have a very good bridge, like a piece of metal. And if you're using a cloth mask from home, just make sure it has that bar built in place, because if it's not tightly sealed around your nose, that's when the fogging will occur, because the air that's coming out of your mouth that you're breathing out will go up into your glasses. So if you fix that problem, if you make this a little bit tighter, or acquire a mask that is a little bit tighter, then the fogging up will improve dramatically.
And I imagine also there's a spray that you can get at the drugstore to help with demisting as well.
That's right. There's anti-fogging spray.
Yeah. For you, Dr. Abbey, what strategies are being used to safeguard mental health and wellness for frontline staff at UHN? And do you foresee significant PTSD from COVID care?
So there is lots of work being done in this area. We have a very strong and long-standing wellness program that is doing a lot of fabulous work. We've got what are called respite centers. And, potentially some of the people who are listening to this broadcast, we've had incredible donations from the community and from our supporters. They're lovely respite centers. People are going there. There's a peer-to-peer support line. There are some online exercise sessions that are being run 4 nights a week. There's online meditation groups for healthcare workers. We've also developed, and again with support from philanthropists, a program called UHN Cares, that coping and resilience for employees and staff, that provides a range of written resources, videos, podcasts, meditations, right up to one-on-one individual sessions with psychiatrists, psychologists, or mental health workers. And finally, we've also had wonderful philanthropic support, and we're developing a program called Restore that's going to be available widely through Ontario to help people recover and restore their lives from COVID.
It's amazing to see the impact of philanthropic dollars, as you say.
Philanthropic dollars have been incredible. And this Restore program, it's going to be so helpful because it's going to be helpful for frontline workers, and it's going to be helpful for the general population. It's really exciting that we've had that.
That's great.
Sort of important for people to know, we often think of kind of trauma equals PTSD. What we now know is that trauma often causes a whole lot of trouble. So depression and anxiety are the 2 most common ones. Some people will end up with PTSD, but we're doing everything we can to prevent that and to ensure that people have early treatment available for them. The other thing that's helpful for people to know is that really across the Greater Toronto area, and for people who are at a greater distance, I think probably in your areas as well, the hospital sector has really come together to help support. So we've been partnered with Mount Sinai to develop capacity to treat people from the intensive critical care community, physicians, nurses, respiratory therapists. So that across hospitals, we're working together to get resources out to frontline staff.
That's so critical. I just want to let everyone know we've been given the green light to extend our time a bit because of all the questions that come in. So if that's okay for you two to stick around with us a little bit longer, that would be fantastic. From Marianne, for you, Dr. Abbey, even practicing mindfulness meditation, I still had panic attacks in the thick of COVID-19. They were quite extreme despite me feeling fine and grounded before bed. With underlying conditions, I worry. What will the long-term effects be on both body and mind?
So I think that there shouldn't be long-term effects. I think the panic attacks are very common. Probably 30 to 40% of the population just normally would have them. I think more have had panic attacks at least once since the start of COVID. So I'd try not to worry about that. If you continue to have them and they're really disruptive to day-to-day life, then I'd reach out and have a conversation with your family doctor, and there are lots of very effective treatments for panic now. So hopefully that'll give you some reassurance.
From Lawrence, thank you for this wonderful opportunity. I am 75 years old and would like to know whether I can go into my corner store and buy a newspaper. I would wear a mask and use a credit card for payment. I'd also like to know whether I can go to my favorite bakery and buy some baked goods for takeout. I'm guessing, Dr. Vaisman, you should tackle that one.
Sure. So I think as long as it's consistent with the provincial guidance in terms of opening up stores, the phases, I think it's certainly safe that for that to be done. I think for elderly individuals, it's going to be a challenge to continue to be living in their own without having any contact with the outside world. At some point, as the number of cases falls in the community, there may be more harm for those individuals to stay in rather than go out, with the corollary that you must be doing it in a very, very safe manner. In other words, taking as little risk as you can. So the things described here make sense: wearing a mask, using credit card, not using cash. I would also add to that is keeping distance, washing hands as well, making as little contact as possible with other people. It is a challenge for people who in 75 years or older to have to be able to make social interactions during this time. But at some point, it will be safe for them to do that. And I think we're near that point, and we'll hear updates from the government about that. Similar would be the bakery situation as well, maintaining those principles. would be important.
Next question from Dawn. What tips do you have for living safely in a modern high-rise condo near COVID-19 hotspots? Can aerosolized COVID-19 virus travel with the positive pressure airflow found in condo hallways into the suites? Modern condos are designed to breathe this way from the hallway to suites as per fire code.
That's an interesting question. I suppose it matters I guess it depends on the specific way that some buildings are designed. I don't know whether the exhaust from one room in one condo would go into the exhaust or would be filtered into the room of another person. In hospitals, for example, that the air is filtered before it goes anywhere back into the hospital, generally speaking, or goes straight out into the outside world. I think overall, it's very unlikely you're going to get COVID from living in a condo simply because it's passed through the vents. On top of that, it's unlikely that most of COVID transmission occurs through aerosolization. It's usually just large droplets due to sneezing or coughing or breathing or talking. So I think it's based on the design of condos and based on the fact that COVID does not aerosolize effectively. I think it's very low risk. If there was a lot of transmission, we would see many outbreaks occurring in congregate settings or even non-congregate settings like a condo across the world, but we're not seeing that, even in places where COVID is very common. So I think it's generally safe to live in the condo, and that the same principles would apply when in an elevator: keep distance, when going out, wash your hands, all the same kind of principles.
So I think you've just answered Angela's question, the next one about how safe is it? I'm wondering how safe elevators are during this time. Does wearing a mask help?
Yeah, I think
if there's anything to add.
Yeah, I think it generally makes sense to continue wearing a mask when you're in an elevator because you're not able to distance. Elevator buttons comes up as a common question. That's going to be very low risk. Again, if you're using the same principles of washing your hands, you're not going to be at much risk by touching those elevator buttons as long as you're not touching your face right afterwards. We should try to minimize the number of people in an elevator. It's very challenging in condos where there's limitations there, but that would be the goal, is try not to crowd an elevator.
It's like you're anticipating each question. The next one is about services. Should I be concerned about touching hard surfaces, i.e. desks, photocopier, grocery store items, etc.? I recently read that this isn't as much of a threat as we initially thought. Thank you.
Yeah, it's certainly possible for virus to survive on those surfaces. It's probably in the range of hours and less likely days. But again, if you're washing your hands routinely, even just the alcohol rub, as I mentioned earlier, it's not as hard to kill COVID as other things. You should be protected from that. So it's a very common problem that we have, is putting our hands near our face, even when we're out in public, biting our nails, wiping our mouths, thinking with our hands below our chins. Those kind of things, we just have to cut that stuff out, and you'll be totally safe to be in these environments if you do that.
Next question. In our condo building with many seniors, we have some people wearing N95 masks, some wearing disposable blue paper masks, some wearing homemade masks, some wearing the large clear face shields instead of a mask, and some people wearing no mask at all. Who is right? You essentially answered that earlier in terms of it's good to protect yourself at all times, especially when you're in confined spaces.
Yes. So either the cloth mask or a medical mask is fine. N95s are not really necessary in these areas because it's not spread through aerosolization. So either the homemade mask or other blue paper mask, as indicated in the question, are totally fine to wear in these indoor settings.
Next question from Sandy. Could you please clarify how asymptomatic people spread the virus? If they are not sneezing or coughing, etc., is it shed in a different way?
That's an excellent question. So there was a statement put out by WHO earlier this week, which they've since retracted or tried to rephrase, about asymptomatic people not being able to spread. The important thing to recognize is that asymptomatic people can be either pre-symptomatic, in other words, they're only a few days away from developing symptoms from the disease. They're post-symptomatic, which means they had the disease, they had symptoms, and now they're getting over the disease. Or it is a patient who's never had symptoms ever. The difference there being is that if you're pre-symptomatic, you're at very high risk of transmitting. So speaking to this question, in that group, even if you're not coughing or sneezing yet, you still may be starting to shed virus in your nasopharynx, in your nose, and in your oropharynx, the back of your throat. So that if you're talking or breathing, there's virus that's actually coming out of your mouth and out of your nose. And if somebody is in close proximity to you, they can pick up the virus, because in the pre-symptomatic phase, you're very transmissible. The viral load is actually very high. That's one of the reasons why COVID is so hard to manage and so hard to prevent, is that people are transmitting the virus before they even know it. They haven't even done anything wrong. Once people have symptoms, they're very good about not going to work, about isolating themselves, but it's that pre-symptomatic period which makes this so challenging.
And from Charlene, this is for you, Dr. Abbey. How do I explain to my teenage daughter that we should maintain a normal sleep schedule for our own sanity and mental health? She's sleeping at 1 to 4 a.m., waking up at 1 to 2 p.m. now. How do I approach this without argument? Well, you've got teenage daughters. How do you do it?
I think we need a miracle worker to answer that question. It is really hard, Charlene. What we have saw off at our house is 2 a.m. lights need to be out. I think if you've got kids, particularly who tend to be more night owls, they're going to want to stay up. They don't have the structure of school. And so long as they're not doing things in the night that are particularly worrisome, or, there's a reason that you have to have eyes on them, I might be tempted to let them do that. We actually had a discussion at the dinner table the other night when I commented to my daughter that really by staying up this way, come September when she's back in school, it's going to be like worse than almost having gone to Asia on a holiday, this is going to be a real case of jet lag, and it's going to be a long period of time to get her sleep switched over. So, maybe it would make more sense to try to just shape it back a little bit more to 1 a.m. But at my own house, I have not had a whole lot of success. So, I wish you luck, but it's challenging.
All right, both of you, thank you so much. We've come to the end of our time today. That was so quick, and I really appreciate all your insights. To all of you at home, thank you for joining us. To our guests, Dr. Alon Vaisman, UHN Infection Control Physician. Sorry about that, Alon. Thank you, Dr. Vaisman. And
Okay.
Dr. Susan Abbey, UHN Psychiatrist-in-Chief. Thank you, Dr. Abbey.
Thank you.
This live stream will be available on the Foundation YouTube page. For anyone interested in donating supplies or support items for our frontline workers, you can email us at covidsupport, that's all one word, covidsupport @uhn.ca, and someone from the Foundation will be glad to speak to you. And finally, donor support is so critical to the work we do at UHN. It helps our frontline workers, our infection prevention and control people, colleagues with Dr. Vaisman, as well as the hundreds of researchers behind the scenes working to find treatments for this deadly virus. If you're able to help, we would ask you to consider making a donation if you visit our website, www.tgwhf.ca/help now. Thanks for tuning in, everyone. Keep practicing physical distancing and stay safe.